Hi everyone, welcome back to the channel. For those of you who are new here, my name is Carol, and the reason I'm sitting here in my pajamas in this video is because I am going to be covering off my top tips for packing for surgery to take out the guesswork and make a stressful situation a little bit more manageable for you. Now, having done surgery 3 times already, I thought it would be a useful exercise to put everything that I have learned on packing onto a handy checklist. And you'll see that this document is available if you follow the link in the comments section below. This is simply a guideline to help you with your packing. Everybody has different preferences, everyone has different lengths of stay in hospital, and you'll find that your particular hospital might have some specific guidelines in what you are and aren't allowed to bring in. So please do check with them if you're unsure about anything. There are 2 very practical reasons why I pack the way that I do. The first one is around mobility. When you wake up from that surgery, all your movement becomes severely restricted. You can't just sit up easily, and you can't roll over and grab and reach for individual items. And as for rummaging around in a toiletry bag to find different items, that becomes extremely frustrating, even more so when you ask somebody to help you. So having everything at arm's length when you need it makes the world of difference. The second reason is that when you are organized in your packing, you will feel a lot more control over your immediate environments. And that is important when everything else around you feels so out of control in those first few days. So my approach is actually very simple. The first thing is I pack everything in these clear Ziploc bags, because if they're in clear bags, you can see for yourself what it is that's inside each bag. And also, by packing them in themed bags, you can just grab one pack at a time, which contains everything you need for that particular task. So if you want to go and brush your teeth, for example, just grab a bag that contains everything you need for brushing your teeth. So let's get into the packing. When I pack, I split things into 3 different categories. The first is clothing, the second is toiletries, and the third is essentials and entertainment. Let's talk about clothing. Now, if you're in the hospital for long enough, or you want to get more comfortable and change into pajamas there once your catheter and IV are out, I prefer to have separate pajamas. It's all up to the individual, but the reason I prefer the separates is that I can put on items that have got a bit of a stretch in them so the fabric won't bunch up in the back around the incision, and bottoms, either shorts or these sorts of bottoms that have a cuff around the ankle so that the fabric isn't pulling up. And then I like to take either a front opening gown or a light warm top to put on for a bit of coverage or to keep a little bit warm if it is cooler inside the hospital. Let's talk about toiletries. My first pack is the bedside essentials, which contain handy things like lip balm, hand cream, a comb, and also I always take a box of pull-out tissues along with me. The toothbrushing bag. The wash bag contains everything you need if you feel ready to get up and do a little bit of a wipe down for yourself, or you've got someone that is visiting you that can help you. I always take a bag with a sanitizer and some hand wipes in case I'm sharing a bathroom. And for your chronic meds, please just check with the hospital if they want you to bring yours in or if they're going to supply them for you. The last pack we have is your daily essentials and some entertainment items, because although you're going to sleep a lot, you might find that when you're awake, you feel like reading or perhaps watching something on your device. So I always make sure that I have my reading glasses, my contact lenses with its solution and the container for the contact lenses, and then everything that I might need in terms of mobile phone, wireless earphones, and my tablets or a book, plus all the charging cables that they need. And lastly, we come to my snack pack that I always take with me when I go into hospital. I know that the hospital will provide you everything that you need for eating and drinking, but what I find most frustrating is when I'm trying to take a sip of something, if it's in a container that can spill easily or that needs me to be getting up to be able to eat or drink at that time, that becomes quite tricky. So I prefer to have a couple of items to make sipping and hydration a lot easier for me. So I take along a travel mug that you can then decant your tea and coffee into. It will stay warm and you can sip it at leisure rather than drinking it up all at once. And then I'm a great big fan of these water bottles with these pop-up tops. You can lie there, you can grab the water, sip all day as you go. It's not going to spill on you. And then a water and a juice box are super handy to have for when you come out of surgery and you go back into the ward. I find I'm always so thirsty when I wake up. So being able to, on my back, have a quick sip of juice and maybe quench my throat further with some water really does make me feel a lot better in the moment. Then lastly, I always find that I get a bit of a blood sugar dip at some point, as well as a blood pressure dip. In fact, blood pressure is something that I struggle with every single time. So I always keep on hand, at the advice of a nurse the first time that I went into hospital, she said always have a packet of salted crisps on hand in the bedside drawer, as well as a little packet of sweets in case you ever need to give yourself a fix quite quickly. Just please first check with the hospital what you are and aren't allowed to have. If you've got a pre-existing condition or they want you on a liquid-only diet, they might be quite strict in what you put in your mouth. So check those things first with them before you take anything in with you. So that's it. You are packed and you are ready, and that takes out so much of the stress already. Just remember to be kind to yourself and allow other people to help you. And really, help them to help you by making things easier for them too. If you found this video helpful, please give it a thumbs up and subscribe so that you can continue receiving my tips from my back surgery journey. See you next time on the Spinal Surgery Survivalist.